Hello, my name is Rochelle Thomas, and my video presentation is on ethical and legal considerations for nursing informatics. Nursing informatics have evolved with advanced technology. It offers nurses an opportunity to easy access for patient information. It also allows nurses to work and communicate interoperably with other entities in the health facility. According to the ANA 2015, there are 95% of healthcare facilities that are using nursing informatics. Nursing informatics has been an easy, accessible tool that nurses use. We can use nursing informatics with our cell phones, mobile technology, tablets, also iPads, and also we use it with our computers. We're able to communicate with other entities by providing recommendations and treatment plans for patients. Usually we had to have conference calls, or maybe we had to have group discussions when we collaborated together with different entities to perform and come up with plans that was necessary for patients to have in order to get the right treatment done. But now that we have the nursing informatics, we're able to retrieve recommendations that were provided by other entities, and it's placed just in the computer where we can easily retrieve the information, the recommendations that were offered, and we can apply them to the treatment plan that we want for the patient. Now that we're able to use this tool, we're able to provide quicker treatment plans for the patient, which we're given. So now that we're having less time retrieving information and collaborating, we can use that time now and we're providing quality care for the patient, as well as the patient is having better outcomes now because of this. What nurses have to be aware of is that when using nursing informatics, that we're not leaking information to people or staff members that's not relevant in the patient's plan of care. So we have to make sure when nurses, as we do bedside shift reports, that we do it at the bedside. The only reason why sometimes we do not do it at the bedside, if the patient has visitors and the visitors may not be the immediate family of the patient, so we don't want to give information to visitors that it's not relevant to the patient's care, and it's not giving the patient its privacy and its medical privacy of the confidentiality. And the patients respect nurses for being able to handle confidentiality and not leak information out to anyone that's not needed in this treatment plan. So sometimes we'll step outside of the room and we'll do bedside shift reporting, but you still have to be aware of passerbyers or people walking in the hallway that may overhear a patient's information. So you have to pause when you're doing bedside shift report outside of the patient's room, or either you can open up the patient's chart because you have the computer right there. Everything is mobile, so you can just show something that's pertinent that you want the oncoming nurse to know, and just point to it, click to it, and you're not verbalizing that information outside in the hallway. Also, nurses have to be aware when they are texting patient information. Sometimes we'll text and say that a patient is arriving to a floor where maybe a nurse is at break or she had left the unit for some reason. We also text the doctors. Sometimes the doctors may ask for a stat EKG. He could be in a procedure room, or he may be still having office hours. So when you're texting pertinent patient information, make sure you're covering up that patient's name so that in case for some reason that EKG is not set to the right receiver and the doctor did not receive it, and he texting you back saying, where is the EKG? That patient's EKG, patient and private information, can be sent somewhere else. So you have to make sure when you're texting that you're being cautious about the name of the patient. Make sure that it's not visible for anyone to see. If the doctor asks, just say that it's such and such a room, last name, when you text. Also, you have to be aware when you're trying to get rid of patient information, the shredder is the possible and the most important aspect of getting rid of patient information. Not just throwing it into the trash or tearing it or ripping it up or putting it in the trash can in the patient's rooms. Sometimes once patients have completed their antibiotic, their IV antibiotic, their name, their birthday is still on that antibiotic. So you have to remove that and still bring it to the shredder. The shredder is the only way that that information is going to be completely removed out of sight of anyone trying to pick up patient information. Also, when we do printouts, sometimes we do printouts for patients for discharge or post procedures. Sometimes we'll do printouts that may have patient discharge instructions on. You have to make sure that once you've copied the information, that you're not leaving it on the copier, that you're not leaving it just on a desktop. You make sure you place it in the shredder. That's the only way you're going to get rid of extra copies of patient information, and it won't be visible for passerbyers. That's not relevant to the patient's care or treatment of patient care to be noticed. Sometimes nurses, staff may lose their electronic devices. This happened before it was a big case. I think it was like in 2012 though it happened, and someone lost their laptop and they had like 300 or more patient information, their home addresses, their social security numbers on them. So we have to make sure that if we use mobile devices at work, even if the organization facility that you're working for has bought them for you, make sure that it's encrypted, where the software is encrypted, so where the patient information, if you do lose a device, they're unable to open it up and get that patient's information. Also, there's also like access tools we use, like when we're at work we use access tools. Make sure that you use a two-way authentication to get into your device if you should lose it. It's a username and a password. Some people use like a digit and a password, but make sure that you're using encrypted software on your electronic devices if you have patient information on them. And also illegally accessing patient information is also a big issue because of social media we have. Also, nurses have to be careful when they're looking up patients' information and they stumble on somebody they may know in a hospital, and they relay that information to other staff members when they go home to the family, neighbors. Nurses have to be aware that once we log into the computer, we put in our username, we put in our password, we're being monitored the entire time that we're logged into the computer. As well as social media, we're being monitored as nurses because they know we have that more obligation for patient safety as well as patient privacy. So this one nurse, she was able to look up a patient information because she knew the patient, and she told staff members, and she also told members in her family. The patient realized who it was who relayed the information